In this case study, the Malaysian Ministry of Health are facing several constraints in order to prevent or to stop the transmission of COVID-19 pandemic because of the several approach to transfer the knowledge is not really suitable. One of the major issues that Malaysian Ministry of Health face is the financial constraint that usually limiting the action or improvement made by the ministry, which involve the matter of low allocation of budget or the expenditure is more than the financial provided. For instance, if the government of Malaysia provide more budget to the Ministry of Health than other ministry during this pandemic, it will help the Ministry of Health have enough financial sources to cover all of the medical expenses to ensure the prevention of the transmission of the COVID-19 pandemic is done in an effective and efficient way. However, the financial sources of the country is limited and not enough to provide more budget only for health, as the other ministry also need enough budget to ensure the efficiency of the government. These matters also arise due to the act of the Ministry of Health, where they didn't give the detailing statistical fraction of the COVID-19 patient in every district that caused the quarantine bed become insufficient during this financial crisis. The act of the ministry where they did not manage or utilize the resources carefully, which is the usage of the bed in every place that caused the bed become insufficient. As was reported in FMT News on 27 October 2020, the problem with the mismatched information between the Ministry of Health, Malaysia Delhi Conference, and the Minister of Local Government and State Housing Sabah, Datuk Seri Masidi Manjun, statement where the amount of the quarantine bed that has been used was stated by MOH during Delhi Conference is contrary to Datuk Masidi's statement, where there are 99.5% of quarantine bed in Sabah already been used on 27 October 2020, said Dr. Subramaniam Munaidi, the MMA president. Due to excessive use of certain hospitals that not really need to use it in a large quantity, this mismatched information caused the shortage of bed in other places, especially places that has high statistic of COVID-19 patients. Not only that, Dr. Subramaniam said it is not practical to use ICU bed in other districts where it will be difficult to transporting the COVID-19 patient that need respiratory assistance without risking other patients and other people. The second challenge is the role of the social media as the main platform to reach society attention about the COVID-19 pandemic. The use of social media become daily routine of almost half of the society. However, there were gap between rural and urban area in terms of accessibility of the internet and technology such as mobile phone and laptop. This is another challenging problem for the Ministry of Health to ensure the society get enough knowledge and important news about the pandemic in order to prevent it in effective way. However, the ministry has the important role to ensure the society know the update of COVID-19 and get the information about the changes or amendment of the standard operating procedure SOP from time to time. Yet, still it will be hard for everyone to adapt with the technology and social media, especially the senior citizen or people who not exposed to technology. This will cause the problem towards the ministry to achieve the objective. This means that the people who easily adapt or already adapt will have advantage, while the other will face the hard time to receive the latest information. The role of social media as the main platform to channel information about COVID-19 with the society that face the difficulty because the society do not know how to acquire and utilize it. Moreover, the problem of fake news always happen that cause the society confused as the information become irrelevant and wrong. The third challenges is for the Ministry of Health ensuring the green zone remain as the safe zone and the red zone become green zone. These matters become one of the big challenges of the Ministry of Health. The objective is greater challenges as society behavior is hard to change. This is because of the act of distrust, lack of understanding and reluctance to adapt with the new norms as some of the numerous boundaries cause the knowledge become difficult. For reason of that, Ministry of Health could not ensure the green zone remain as the safe zone and red zone become green zone. These problems are created by the society or the individual way of thinking itself. Some of the society didn't want to change the behavior and result to the target hard to achieve. The Ministry of Health has issued instruction to tightening the practice of SOP in every place that people visit, yet still there are several people who are not following the order. The last challenges is for the Ministry of Health ensuring the people under observation stay at their place. These challenges arise due to the irresponsible behavior of certain people that has given order to self-quarantine disobey the order. This act will cause harm to the society and country. The ministry has stated 5 types of color for the quarantine bracelet, such as white, pink, blue, yellow, and red. This action is to ensure the people under observation, which suspected as the close contact of COVID-19 patient, are easily recognized by the authority to prevent them to go to the public places as the results are not yet confirmed. However, the people disobeyed the order and cutting their wristband and caused the public panic. It means that the knowledge about the dangers of COVID-19 effect is not really delivered successfully, as there are still people who didn't care about it, and seems that the way of the ministry sharing the dangerous effect of the pandemic is not really effective, and some of the people didn't want to utilize it.